Hello, a very good morning. I am Dr. SVS Dev. I am the Oncology Lead and Senior Consultant Surgical Oncology at Indraprastha Apollo Hospitals, New Delhi. I am also the President of Association of Breast Surgeons of India and President of Indian Association of Surgical Oncology. Genetic factors play a very important role in the causation of breast cancer. Around 15 to 20% of breast cancers can run in families. This is what we call familial or hereditary breast cancers. So we have a lot of advances which have been made in the last 20 years, where now we can identify the genes which can cause breast cancer and also can diagnose these patients before they develop cancer and help them and their families. You see, there are certain types of genes which will increase the risk of development of breast cancer. For example, BRCA1 and BRCA2. Suppose you have these mutations in an individual, the chances of developing breast cancer can go as high as 70 to 80% during the lifetime compared to a normal individual. So this is what we call a high-risk gene mutations. So what we try to do in the cancer genetics is to identify the patients who have these mutations and the treatment approach, and it will also help the family members. So there are a lot of genes which are involved in the breast cancer causation, but there are around 5 to 6 genes which have a very high risk of converting the normal breast tissues into a breast cancer in a normal individual. Yeah, so what we do is there are certain red flags you have to be careful as a clinician when you see a patient of a breast cancer. So we normally ask few questions regarding the family history. If somebody in the family is affected with a breast or ovarian cancer, especially the first degree or second degree relatives like a mother, grandmother or an aunt, if there is a history of breast and ovarian cancer, this is the first warning sign so that the cancer may be running in the families. In addition, we also look at other factors like cancers developing in a younger age, less than 40, 45. That is again a warning sign. So there may be something wrong with your genes. And also any history of cancer in the family related to prostate or pancreatic cancer. So these are certain warning signs you have to be careful. When you find this, what we normally do is we do the genetic counseling and we make the patient and their family understand the types of genetic testing which are available and the implications to the family and the patient, because genetic testing is not like any other testing. So it has got a familial and of course the societal implications. So they need to understand if suppose a mutation comes, how they need to tackle it, what are the options available. So that needs to be discussed. That is why genetic counseling plays a very important role before you go for genetic testing. So let us talk about how you handle patients with mutation. We have various options. Suppose we know there is a mutation. So what we offer to these patients to prevent cancer in the other breast or ovarian cancers, we also offer them surgery, what we call prophylactic surgery or risk reducing surgery. So this is a new field where you are going to remove the normal organs before they develop cancer to prevent the development of cancer and improve the survival. So this is what we are doing in our center at Delhi also. So this is one of the main advantages. So you can predict the development of cancer and preempt the chances of development of cancer by operating these individuals. They are normal individuals, by you remove the organs and you can save the lives. So this is called risk reducing surgery. Apart from that, we also advise certain lifestyle modifications, especially for breast cancer. A healthy lifestyle, balanced lifestyle is extremely important. The common risk factors include obesity, sedentary lifestyles. So we encourage physical activity, vegetarian food, a balanced exercise, healthy lifestyle will definitely decrease the risk of breast cancer by almost 10 to 15%. So the other option is they can choose for surveillance. So we keep follow-up of these patients, we keep doing regular mammograms and MRIs so that you can pick up the breast cancer at a very, very early stage so that your chances of cure will go up. Yeah, so this conference is a landmark conference. If you look at the entire scientific program and the gathering, the Apollo Cancer Conclave 2024 Mumbai is a landmark sort of event where we try to put together the recent advances and the latest technologies which are available in India, not only all over the world, but in India, and to showcase what can be offered to the Indian cancer patients for prevention, diagnosis, treatment, and improvement of overall outcomes of cancer in India. Thank you very much.